So yeah, my talk is called Why Implementing an Electronic Witnessing System is Crucial in a Fertility Centre. And by the end of this brief presentation, you'll be reminded of a critical issue that needs addressing and understand why electronic witnessing is not just important, but essential in a fertility centre. My aim is to highlight 5 key considerations for selecting the right system and to demonstrate the numerous benefits of implementing Matcher, which offers more than just electronic witnessing. And as David has said, we will have time at the end to answer your questions, so please don't forget to add them to the Q&A box as we go along. Therefore, without further ado, let's remind ourselves of that key issue. Humans make mistakes, which is why replacing human decision-making with an electronic witnessing system is crucial for helping fertility centres and donor banks to prevent misidentification of patients and their gametes and embryos. Our journey at IMT Matcher started after a significant error at Leeds General Infirmary, where mixed-race twins were born to a white couple due to a sperm mix-up. The resulting inquiry by Professor Brian Toft highlighted the severe consequences of errors, including personal tragedy, litigation, financial expense, and reputational damage. In fact, the UK was the first to mandate double witnessing, setting a benchmark for legislation like the EU Tissues and Cells Directive and CAP requirements in the USA. Unfortunately, however, this was not an isolated incident, and we don't have to look very far to find lots of examples, even some very recently, in fertility centres and donor banks. There are many such examples, and here are just some of the cases that we've compiled, resulting in the loss of embryos or even the wrong baby being born, occurring just over the last decade. These examples not only highlight that mistakes do happen, that's without question, but they also help us to understand why mistakes happen, so we can hopefully develop countermeasures to help in trapping, preventing, and mitigating some of the risks for fertility centres, such as the risks associated with mix-ups with patients with the same last name, lost gametes and embryos because of poor record systems and cryogovernance, and poor patient outcomes because proper procedures were not followed. But what exactly is the risk? There are so far just a few published articles, some very recently, that have successfully analysed data captured from electronic witnessing systems to establish the true error rate in a cycle of treatment. More of the recent studies evaluate a wider range of error types than previous studies. So, for example, a study of very large data performed recently at Leeds University revealed that out of 415,000 procedures analysed, a total of 2,400 so-called oops moments occurred, which included selecting the wrong dish from an incubator, selecting the wrongly numbered gamete or embryo in a process, or bringing non-matching dishes or tubes into a work area. They're called oops moments because in all cases, the errors were trapped and prevented by the electronic witness system. However, it does highlight the fallibility of humans is likely to be considerably higher than we first thought. Electronic witnessing is crucial because it removes the reliance on human decision-making. This is the problem we really need to solve. It seemed like a good idea at the time when human double-checking was introduced in the early noughties in response to those mistakes, and it was. But times moved on, and the industry now has access to very well-developed and fully validated electronic systems that can use electronic identifiers like barcodes to do this for you. You can completely replace the second person with an electronic witnessing system that actually does the job better, because removing the human together with the human factors that they're vulnerable to means that the risk of error is greatly reduced. And choosing to take positive and proactive steps to enhance your total quality management is always a perfect opportunity to review your current practices and consider the factors that are most important for improvement. So to keep it simple, we can break these down into 5 key areas: comprehensiveness of error prevention, ease of use and integration, reducing staff time and workload, enhancing your total quality management system, so not just electronic witnessing, and insights for compliance and your continual improvement. Regarding comprehensiveness of error prevention, What procedures should be covered and where? And the short answer to this question is everything and everywhere. Right from the point of registration, it's crucial that the patient and their gametes and embryos can be witnessed and tracked through their whole cycle, whatever type of cycle that may be. The patient's chain of custody is only as strong as its weakest link. Therefore, electronic witnessing should cover all processes, including diagnostics and clinical procedures in treatment and in the operating rooms, nurse checks of patient IDs, semen collection and sperm preparation, IVF and ICSI, but also include processes like biopsy for PGT and movements into and out of the cryostores, transfer, and even disposal. For example, the steps in an ICSI cycle have increased with the introduction of biopsy for PGT, and this increased workload can't be overlooked when it comes to electronic witnessing. Now, verifying correctly numbered gametes, embryos, or cells in various processes is essential, and this adds 3 or 4 procedures per biopsy per cycle. And this work is highly skilled and repetitive, which further increases the risk of errors where practitioners may become distracted or fatigued. Additionally, selection of the fate of every embryo is now imperative to avoid accidentally transferring suboptimal embryos that may not lead to a live birth or could cause genetic disorders. This responsibility places a significant burden on embryologists to ensure that the right patient and the right embryo are selected, as mistakes could have severe consequences. There are further subtle risks too. For example, a survey conducted by Caitlin Flynn at Leeds University revealed the average number of biopsies being processed in a single biopsy dish to be 4, with some clinics willing to place more than this into a single dish. And this creates challenges around maintaining that chain of custody of an individual embryo through the process. And Flynn also reported that once PGT results are known, most clinics surveyed don't dispose of aneuploid or mosaic embryos, or even separate them from the rest of the cohort in a cryovessel. This obviously creates risk in terms of selecting the correct embryo for transfer at the point of warming, especially if there's no electronic check performed at this point. So how can you implement control measures to mitigate the risks surrounding biopsy for PGT? The solution can be embryo-level witnessing and traceability using uniquely numbered and barcoded labels. With Matcher, you can utilize the uniqueness of individually numbered and barcoded groups of labels printed on a single label sheet, reflecting the groups of embryos selected as candidates for biopsy. And then you can use these uniquely numbered barcodes to witness and track the correctly numbered biopsies and embryos through the separate processes of biopsy and vitrification, all the way through to validating the movement of the embryos into the cryostores. And this even includes cases where multiple embryos are being placed into a single biopsy dish. And finally, when the PGT results are known, the selection of the fate of the embryos can then be made. This might be for transfer, but it could be for safe disposal, or even for demarcating aneuploid or mosaic embryos that must remain in storage for now, but must not be transferred. If the wrong embryo is scanned at the point of warming, before it's removed from the cryostores, a clear audio-visual alarm will alert the embryologist that this is the right patient, but it's the wrong embryo. When choosing the right system, the hardware components should be easy to install, but crucially, without any modifications to existing equipment or work areas. Scanning devices are great for this. And finding ways to reduce staff time and workload is also crucial. For example, if one equates the time savings just relating to the number of procedures witnessed, the fertility centre can save, on average, 116 seconds for every procedure performed. So in a medium-sized clinic performing around 2,000 IVF or ICSI cycles and 1,000 FETs or IUIs, that's almost 150 working days saved per year, and that's just witnessing procedures. Can you imagine what fertility centres could do with that time if they were given it back? And in just that 10 seconds it takes to witness the procedure, you can record a wealth of information or data captured in real time that covers the who, the where, the what, the when, and often the why, especially in the cases of an error or a deviation from a standard operating procedure. And this includes photographs, and a picture tells 1,000 words. We're aware of cases where photographs have been successfully used as a proof that a process was followed correctly, and this makes them worth their weight in gold. Handwriting on Petri dishes and test tubes, and especially on items where space is limited, is also a waste of time. And it's a risky practice too, because of the variability and illegibility of a person's handwriting. Matcher saves an enormous amount of time because all labels, together with their unique barcodes for an entire cycle of treatment, are printed with just one button click at the start of the patient's cycle. The labels are much safer than any other type of identifier too, because dishes and tubes entering a work area have already been assigned to that patient in advance, which means that the electronic system doesn't require any human decision making when the IDs are checked in a witnessing step by the electronic system. Get rid of the handwriting. And then there's the time it takes to schedule everyday workflow and daily tasks. Even now, the whiteboard remains a popular method for administering this, which is prone to risk due to human factors that lead to human errors. An electronic system, on the other hand, provides a very useful tool in an ART lab because it provides a real-time overview of patient workflow and patient cycle status. This is what you said you were going to do for this cycle of treatment, and it allows you to see immediately if something out of the ordinary's happened, or if the task is overdue, or if there's been a non-conformance that quickly needs reviewing, for example. Replacing the outdated practice of trying to record lot numbers, another time-saving and risk area. So in a paper-based system or spreadsheet should really be considered as crucial. So replacing the paper-based system should be considered as crucial, especially considering recent product lot recalls that have highlighted further risks within IVF. Global standard, or GS1, barcodes already applied to most consumable products of healthcare are designed to make this process more efficient, and the well-developed electronic witnessing systems can integrate these. Matcher's especially brilliant at this because it automatically links every product coming into contact with the patient or their gametes and embryos to its respective procedure at the point of use in real time. Tracking stock inventory and expiry dates can also be automated, so that's two other things that you don't need to worry about. And finally, manual cryo management and cryo auditing are time-consuming and risky processes. It's worth considering whether these two outdated practices should be replaced by safer digital alternatives. Cryo inventory movements can now be verified using those globally unique barcodes quite safely in real time. The electronic system will even manage how much space is available in the vessels and maintain a rolling stock level of gametes and embryos available for transfer. And once all of the data has been captured, Matcher's interactive insights dashboards provides the power to answer all of your most important questions, giving Matcher users an unparalleled comparative advantage compared to fertility centres who are not using the system. So these are questions like how many errors were made this week or this year, but not only that, where were the errors made and who made the errors and how often has there been a deviation from an SOP? Are all of the tasks that were planned for today finished? How much space is left in the cryo stores? Which patients have been in contact with that particular recalled product lot? All of this incredibly useful information is available at your fingertips, and it can be drilled into and used to identify inefficiencies, provide real-time insights on items that need action. It can inform root cause analysis, assist with compliance, enhance quality management, and it can also help you to visualize trend outliers and anomalies. And it's great for satisfying requests from competent authorities or regulators more efficiently. Matcher's developed into much more than just electronic witnessing. It also covers many other features that can be used to enhance the centre's total quality management, not just witnessing. Matcher should be regarded as a comprehensive traceability system that uses real-time data capture to facilitate compliance. It's a regulator's, a fertility centre director's and a quality manager's dream. And we're aware of many examples of where Matcher's been used to successfully demonstrate that mistakes have not occurred as a vital component of a fertility centre's risk strategy. And we're also aware that Matcher is being used to help drive efficiencies in the lab, which leads to improved outcomes and results. And our next speaker, Dr. Tricia Adams, will be covering this in more detail in our next presentation. Reflecting our specialist customer-centric thinking, Matcher's features are each purposefully crafted to ensure industry-leading patient and sample identification, minimise the risk to patients and staff, and streamline working practices in fertility centres and also donor banks. And this is why Matcher is different from any other witnessing systems.